Children are not small adults, so their illness are different and complex due to the physiological difference, including an immature immunity, unique dark metabolisms, and atypical disease presentations. Their bodies are constantly growing and developing, which affect the disease appear and progress. And another one, children cannot clearly communicate their symptoms, so they need a specialized expertise to assess their condition. The congenital and genetic conditions are more common in children that need specialized management. So for children care, pediatric care requires the specialized doctors, specialized equipment, and specialized facility designs for taking care of the children. There are three factors for our success. The first one is our team of the over 100 specialties, doctors, pediatricians, and also the pediatric nurse and a support clinical team that we can take care of all the subspecialties. The second one is about we constantly invest in the advanced medical equipment for the complex procedure. And the third one is about the partnership with the leading institute, including the Don Baker Children's Hospital in US and Takasugi Hospital in Japan, that strengthening our capability. And also we have the comprehensive support for the international families, more than 100 countries, for the multilingual services, the dedicated care coordinators for the patients, and also the teleconsultation for pre-hospital before they coming and after for the follow-up as well. We have made great progress in complex pediatric care. The first one is about the heart surgery. We have treated more than 400 children with the congenital heart defects. And right now we move to we call the minimal invasive heart surgery, using the intervention cardiac catheterizations. And in the bone marrow transplant in patients with the cancers and blood disease, we have done haploidentical transplantations for many years, achieving 92% of 1 year survival rate. And we move on to the CAR T-cell therapy in patients with leukemia and lymphoma. And for our patient with epilepsy, we treated the patients what we call drug-resistant epilepsies with an approach including the ketogenic diet, the epilepsy surgery, and vagus nerve stimulator implantation, VNS implantations. And for the patient with the neurological conditions and motility challenges, our rehabilitation center, we use the robotic-assisted gait training and the hybrid assistive limb HAL system for recovery of our patients.
Let me explain about the heart disease in children. We classify it to congenital. It happens in utero and may be present after birth. And later in life, it will be called the acquired heart disease, which is maybe caused by viral infection like a viral myocarditis, the inflammation of the muscle of the heart. The other is a febrile illness like acute Kawasaki disease, which is we don't know the exact causative agent, but it happens via the immunity in the body, which is stimulated by some agent we don't know. And the patient maybe have a fever for more than 5 days. The eye injection like a red eye, the lips is red, the tongue is red, and the skin have lashes in the skin, which is we have to investigate by doing the blood test. It will be show us about the inflammation in the body. That is a spectrum of Kawasaki disease. There is many diseases that acquire later, but we will focus on the congenital heart disease, which is classified simply as cyanotic and non-cyanotic. It's depending on the defect, variety of defect, and severity of the defect. In the past, we have the treatment like open heart surgery to correct the defect. Some patients maybe not need the open heart surgery, just observation and follow up because its severity is very low. Nowadays, we have the cardiac catheterization, which is we can use it as a diagnostic investigation or the treatment we call intervention. There is an increasing number of the patients that we can use the cardiac catheterization and cardiac intervention to treat. We have the great operating theater in the country, in the university hospital, in the government hospital, even in the private hospital. We already mentioned that there's a variety of defects that we can use the cardiac intervention to treat, to correct, and to palliative to help lessen the severity of the defect, which is nowadays is more increasing number of patients that go to the intervention to close the hole, to open the cardiac valve, that's stenosis, to close the vessel that we don't want it anymore, like a patent ductus arteriosus. We can use the device to close it. This is a very simple one. In the past, we already accept that open heart surgery take more time and take more recovery time. Usually 5 to 7 days in the simple defect. In the complex one, it's maybe over 10 to 14 days, depending on the complication of the patient one by one. And for the intervention, cardiac care and intervention, it's depending on the defect also. Like if we close a simple hole, we close the connecting vessel, or even we put a stent to dilate the connecting vessel, it may take about 1 or 2 days in the hospital. There's no surgical scar and wound. At Samitivej International Children's Hospital here, we already did the open heart surgery for more than 15 years, and the result of the surgery over the past 10 years, we didn't have any mortality, and we did the surgery allow nearly 400 cases. And for the cardiac intervention, right now we increasing the number of the cardiac intervention by cardiac catheterization. We can close the simple hole, we can close the connecting vessel, we can do the embolization to the vessel that we don't want it in the complex heart disease. We can do the balloon dilatation and put the stent in the stenotic vessel. Right now we have a lot of cases coming in, and we try to do our best to treat the following patient that coming in. I think we will do the benefit to the society also. We did a lot of cases of open heart surgery for the foundation, which is over more than 270 cases right now.
When you treat the patient with cancer, especially like a leukemia or lymphoma, and sometimes the patient need a bone marrow transplant to get cured because the patient in terms of got the treatment with the conventional chemotherapy is not successful. So that's why the patient need a bone marrow transplant. However, but right now, sometimes if the patient fail with the conventional chemotherapy, we have a new method we call the CAR T cells. CAR T cell is abbreviated from the chimeric antigen receptor T cells. Make a long story short, you can get the T cell from the patient and go to the lab and do some kind of genetic engineering to make that kind of T cell from the patient to get stronger like a Superman and put it back to the patient. So that's why some patient, you don't need the patient to go to the transplantation. So just after we fail the conventional treatment with the chemotherapy, this kind of leukemia, lymphoma, just get a CAR T cell and can get cure and remission. So it's some kind of another way how to bring the patient to get cured. And actually the CAR T cell has been approved in the US since 2017, but in Thailand it just happened. So right now I'm kind of working at Samitivej Hospital, and then part of that I'm kind of professor pediatric at Mahidol University. So we bring the technology from academic institution and come to the private hospital. And you know that the children Samitivej Hospital, it's only children hospital in some of the private sector in Thailand. So we can accept that the patient all over the world who has not been cured by the regular or conventional treatment, especially the patient with acute lymphoblastic leukemia, we can give a new hope to the patient with a cheaper price, affordable cost something, because the cost of treatment of CAR T cell outside Thailand, especially from in Singapore or in the US, it costs around $400,000. In this hospital, we can bring down the price with the same quality of CAR, like a GMP standard, and then the same outcome, the same thing, and with probably around 10 to 20 times less in terms of cost of treatment. So this hospital, the Samitivej Children Hospital, we start the stem cell or bone marrow transplant unit since 2004. So right now we treat the patient with the bone marrow transplant is almost 150 patients, which is a good number of the patient. And actually the doctor and the nurse team actually here we adopt from the Mahidol University. So together we have some kind of good in terms of experienced staff, in terms of physician and nurses. So in terms of complication, right now we have some kind much less and less, and it's equal to the US or European standard, especially like in terms of mortality rate. I think we probably around less than 3%, which is pretty much the same in US or in European country. And the other thing that I would like to some kind of express in terms of how good we are, especially the donor of the transplant, we are not going to do only the matched sibling, and we can do the matched unrelated, and actually we can do the haploidentical. So what does it mean haploidentical? It means that if the kids need the transplant, you need some kind of match, a matching donor. So basically you can get matching from the sibling or from the unrelated, but in some kids they cannot find a matched donor, so you can use father or mother, which is around 50% matching. In the past 10 years ago, we cannot do, but right now at Samitivej Hospital, we can do the haploidentical, especially in the group of leukemia and thalassemia, with the success rate more than 90%. And the complication we have much less than the past, because with the good experience of the doctor and nurses, so we can handle, and we compare to the US or European or the other country, and we have some kind of same outcome and less morbidity and mortality. As I told you that since we start the bone marrow transplantation unit in this hospital since 2004, and right now we perform the transplant in kids almost around 150 patients, and we accept the patient right now around 10 to 20 patients a year, and we have more and more experience. So the success rate of the transplantation here is over 90%, especially we do some kind of difficult cases, such as we just get the donor from father or mother. That's what we call the haploidentical. That not many countries can do that. And the success rate in this center is more than 90% and less morbidity and mortality. And why? Because we have more and more experience, especially we have a very good staff in terms of nurses and doctors who can handle the problem or something. And I think in the next 1 or 2 years right now, we're going to have another new modality to treat the thalassemia. We call the gene therapy, especially the patient who cannot find a donor no matter what. So this patient, we can get the own patient stem cells, bring to the lab and get the genetic engineering to collect a gene, the globin gene, the beta globin gene, and put it back to the patient. We have that experience already among the academic hospital, Ramatipudi Hospital. We already treated 4 patients, and right now we are going to open in terms of develop here. I hope that we can bring this new technology for the gene therapy in thalassemia in 2026.
We can find the epilepsy children since the child was birth because it is the brain abnormal. The brain abnormal can be seen in the birth, and the condition that cause the brain pathology it usually may be caused from the genetic cause. But after the birth, in some patients, it caused from the birth injury. Some patients can from the infection disease that affect to the brain. We treat firstly, we usually rescue the patient with the medication. We use the medication to control the seizure, and we try to find out what is the cause. We try to treat with the underlying by the cause. Some cause we can treatable, such as infection, but some cause we cannot treat, we can just supportive treatment. Mostly we use medication, but when the patient have epilepsy, some case we use additional treatment such as the ketogenic diet. And if we have find some lesion in the brain, such as the cause of the epilepsy, some case we can resection the lesion in the brain, we will do the surgery for the treatment. But some case, because the brain lesion is very wide and we cannot surgery, or it may be cause the risk benefit cannot do, we use the palliative surgery, such as the resection some pathway of the brain pathology, or we use some machine that we use the neural stimulation, such as vagal nerve stimulation. Traditional, we usually use medicine and some of the diet, because we call ketogenic diet. But for the advanced treatment, we usually do the surgery. Surgery have curable surgery. For if we have the lesion, know why is the lesion that cause the brain cause epilepsy, we usually do the resection, the lesion. But when the some part cannot surgery, we do the palliative surgery. We have alternative treatment if the ketogenic diet, that the diet that have more cause of the decrease the carbohydrate, and we use the lipid for the patient. If the patient have the ketone in the blood at very high, it may be have effective in control the epilepsy. The second thing we use the palliative, we call the vagal nerve stimulation. If some case of the patient that got focal epilepsy and we cannot resection the lesion, we use the vagal nerve stimulation. We use the neural stimulation to patch. If the seizure comes, the vagal nerve stimulation will implant, and it can stop the seizure to decrease the severity of the seizure and short time of the seizure. We have done 2 cases of the patient in our hospital now. Most of the case he can decrease the seizure activity more than 50%. And our challenge is we plan to do the deep brain stimulation. It is another technique for brain stimulation for palliative. And the challenge, the most important thing, we try to find out the curable surgery, because the curable surgery is really important. If we can define, we do the curable surgery for 2 cases. One case, we can do it and success. The seizure stop, we can decrease the medicine, and the quality of life development of the kid is very good. The challenge is the surgery, brain epilepsy surgery for curable. We concern the patient as the holistic epilepsy care. We concern after treatment, not just the treatment of the epilepsy, we usually concern about the side effect of the medication, quality of life, and the stress of the patient. Because the epilepsy just don't only have the epilepsy, he usually have the other problem, such as the psychological or developmental problem. We have to treat epilepsy. When the epilepsy subsides, we usually rehabilitation the patient by the physiotherapy, occupational therapy, or individual enhancement for the cognitive to improve the quality of life of the patient.
At our center, we encounter a wide range of patients, such as the patient from hypoxic encephalopathy, also known as cerebral palsy, and we also encounter the cases with a very severe case from congenital condition. I think conventional is still important, but it's not insufficient because we need a new technology to enhance the recovery. So the conventional therapy still can handle the normal case such as the spasticity, the contracture of the patient, or the weakness. But with the innovative technology that we have, we can enhance the recovery of the children with disability very quickly. Because of the children, they never learn how to use the muscle for walking or for standing. That's why the robotic can enhance them to use the muscle properly and coordinatingly to walking or standing. So the robotic assistant will enhance the children a lot on the training of the children who never walk again. And that's one of our success story. Because a lot of patients coming, they go to several places in the world and they could not reach that point. So we use the technology to enhance the muscle to coordinate the walking. That's why the robotic assisted therapy, or we say it this way, robotic walking therapy assistant will help the children with disability to walk again. As I mentioned, the conventional therapy is still important, but with the innovative, the children never know how to use. So we use the technology promptly or properly, because the technology or even the innovative technology that can purchase or can find anywhere. But I think one of our success story is how we use it properly to that cases. I think that's very important part of our team for the success story of that cases. So the innovative, if we use it properly, like a lot of innovative technology, if we use it properly, it will enhance the work of this world. For the robotic assistant, they are already well known for the adult patient who have a stroke patient or who have the weakness of one side that very enhanced in the guideline already. But for the children, still a long way to go. But our center is the first one who have the locomotive center for children. Let's say this way, maybe the first or the second in the world, not in the Asian. We have the locomotive for the children. So they can enhance, that I mentioned, to enhance the use of the muscle properly for them to know. That's one thing. And the other thing is, a lot of people don't know about, you can use the locomotive for exercise, those muscles. Sometimes if without the robotic, they could not exercise. You can go to swimming pool, but not exercise the walking muscle coordinatingly. So I think the robotic can help that. We have a lot of patients who come from several places in the world, and they could not reach that point of independency. So with our innovative technology, including the robotic assisted walking therapy and NeuRack is something that innovative as well for training the core muscle. We adapted from the NeuRack that used for the back muscle for adult, but we use for the children. It's the very first pioneer in the world as well. So I think that one will enhance the core muscle with the walking. So that's the part that the success story of a lot of cases that they could not go and they could not walking at all. We start to walk them back again. We have a lot of cases like that. Another part of our success story is the team. I think with our team, a lot of children, even I gave a lecture in many places in the world, they don't understand. They said disabled child is disabled child, but about 20% have a course that can fix and enhance the recovery of that disabled child. I think that's important thing that I want to send the message to any people or the doctor who care this group of patients. Right now, we also accept or encounter the cases that are severe. They have the breathing problem, they have the eating problem, or they have the pneumonia, and that are difficult cases. But I think that a critical one that we also can handling at our PPCU, Progressive Patient Care Center, or PICU, that we can handle those cases with our specialty on the intensive care to improve the bleeding, to improve the heart condition of the patient. So these are the critical ones. I think critical care, we have a lot of our action on the rehab, because the rehab can enhance the recovery of breathing. That's the important part of human life. If you cannot breathing, you have a lot of problems. So with the enhance of the rehabilitation low in the breathing, then the oxygenation to the brain will be very good. So that's the first part. And then we can enhance or by prevention another secondary disability, such as the joint contracture or the wound or anything else allowed when they have to be in critical care. That's a part of rehabilitation as well.
We have received several prestigious recognitions such as the Bone Marrow Transplant Service Provider of the Year in 2024 from the Global Health Asia Pacific Award, the Best Children's Hospitals of the Year from the Middle East Healthcare Leadership Award, and also the Excellence in Talent Development for our program Pediatric Emergency Medicine Training Program in 2022 from HMA Hospital Management Asia. Our recognitions mean that we are committed to excellence for the pediatric care. We implement the comprehensive multidisciplinary approach for both physically and developmental need. We have a full team of specialties working together that we use not only the medical treatment but also the developmental support and rehabilitations and psychological care. This integrated approach makes the fast recovery and good outcome for our young patients. We integrate the innovations such as the biplane imaging that we use in our hybrid OR. We have used the CAR T cells for the patient with the cancers, the robotic-assisted for the robotic-assisted training for our rehabilitations, and for the treatment of epilepsy with a new approach like a VNS implantations. We also use the whole genome sequencing for the genetic conditions, and we have the AI assisted for the growth assessment, and we also use the teleconsultations, the telemedicine for the patients, international patients that they can consult before they travel and use for follow-up as well. We work with the a partnership with the leading institutes such as the Don Baker Children's Hospitals, Oregon Health and Science University in US, and Takasugi Hospital in Japan. This can strengthening our capabilities in the area of the emergency care, critical care, newborn care, and also in some area for management, special areas such as the allergy management. Our smart hospital ecosystems focus in two areas. For our patients, our smart OPD, we have the Well Kits applications, KIDZ Well Kits applications that we use for appointment, vaccinations for the queue systems, teleconsultations for patients before they come to the hospital. For inpatient, our smart IPD, we provide a real-time price estimator, condition tracking for the patients for operation that we call Samitivej pace, and communication with the parents that we call for the real-time communications with the parents. Both systems, Smart OPD and Smart IPD, working together to create the seamless digital healthcare experience to our patients that can reduce the waiting time and improve the outcome of our patients.